So, hello everyone again. Welcome to this session. This is the physical therapy for myositis. This is the one for other form of myositis other than IBM. So we're focusing on polymyositis, dermatomyositis, and necrotizing myopathy. My name is Ruben, Pagkatipunan, physical therapy at the Johns Hopkins Myositis Center. And I've been seeing myositis patients for over 10 years. And I've had the privilege of treating various forms of myositis, ranging from PM, DM, necrotizing, IBM, and other forms. So I use exercise as my central part of treatment and management for this patient population. So in this session, I'll be sharing my clinical experiences and insights on how targeted exercise can be an effective tool in managing these conditions. So in this session, we will explore the clinical features of PM, DM, necrotizing myopathy, and anti-synthetase, with a particular focus on the specific muscle groups involved and how these conditions impact mobility. We will examine the muscle impairments affected by each condition. We will discuss exercise intervention strategies and exercise guidelines. We will also discuss targeted exercise aimed at improving muscle strength and endurance in the affected muscle groups. By the end of this session, I'm hoping that you will gain a deeper understanding of how myositis conditions affect movement and what constitutes an effective treatment intervention. So there will be a chance for questions at the end of the presentation. So before I dive in, I'd like to clarify that the health information shared in this session is meant for informational and educational purposes only. It's not a substitute for professional medical advice. For specific recommendation with regards to your health needs, fitness goals, or mobility issues, please consult your doctor, PTs, and other healthcare providers. So I want to begin by giving you a quick overview of the clinical features of polymyositis and dermatomyositis as it relates to muscle impairments. So as you all know, PM and DM are rare autoimmune muscle disorders characterized by muscle inflammation. The muscle inflammation is triggered by an autoimmune response, and because of the muscle inflammation, it leads to chronic muscle weakness. DM presents with skin manifestation and muscle weakness, whereas PM presents with proximal muscle weakness without the skin manifestation. Both PM and DM primarily affect the muscle closest to your body, which are your shoulder and your hips, and it can also affect the neck flexors. Because this condition primarily involves the muscle of the shoulder and the hips, it makes it challenging for patients with these myositis forms to stand up from a seated position, especially when the seat is low, difficulty climbing stairs, difficulty reaching overhead, or perform anything like repetitive, sustained activity using their arms or their legs. And because of those muscle weakness, it can lead to gait unsteadiness. Necrotizing myopathy is also a rare autoimmune muscle disease, and it is characterized also by proximal muscle weakness, shoulder and the hips, but it's more severe than PM and DM. And if you look at the muscle biopsy of this patient, there is less muscle inflammation, but more prominent muscle necrosis. And the muscle necrosis causes severe elevation of the muscle enzyme, the CK level, which result in severe muscle weakness. The muscle weakness is also symmetrical, and it can affect both shoulders and the hips, and also the neck flexors. Depending on the extent of muscle damage, it may be hard for a person with necrotizing myopathy, like if they have what we call fatty replacement of the muscle. It becomes so difficult to rehabilitate those patients because pretty much there's muscle necrosis and the muscle turn into fats. So, but in those cases, it's so hard to strengthen them, but you may have to use other surrounding muscle groups that are not affected. And there are three types of necrotizing. You have the antibody negative, SRP, and HMGCR. And all of these three types of necrotizing myopathy are characterized by rapid progression of severe muscle weakness. And the reason for that is in this condition, there is severe elevation of the muscle enzyme as a result of the muscle necrosis. This is another form of myositis. It's called the anti-synthetase syndrome, which is associated with the presence of JO1 antibodies. And it can manifest through a range of symptoms, including interstitial lung disease, myositis, inflammatory arthritis, Raynaud's phenomenon, and Mechanic's hand. For this condition, as many as 75% of this patient with anti-synthetase have ILD, interstitial lung disease. And interstitial lung disease, this is a lung disorder that is caused by inflammation and scarring of the lung tissue, leading to breathing difficulties and reduced oxygen intake. The pattern of muscle weakness in anti-synthetase is similar to PM and DM. It can affect either shoulder or both shoulder and hips. It can also include the muscle for swallowing and also the neck flexors. It can cause Raynaud's, which can cause like color changes in the fingers and toes, and it can affect the fingers and toes, so it may feel cold and numb during an episode of Raynaud's. Mechanic's hand, this is another manifestation of anti-synthetase and DM, and it is associated with inflammation. Mechanic's hand, this is like a skin condition where the side of the fingers can become dry and rough, and the skin may develop cracks or fissures, especially around the knuckles. So in myositis, as I mentioned before, we often see a distinct pattern of muscle weakness affecting the shoulders and the hips. In the following slides, I will break down which specific muscle groups are involved in the shoulder and the hip regions, and we will explore how weakness in these areas can impact your mobility. So I'm just going to give you a quick anatomy of what myositis really targets. So these are the hip muscles affected in myositis. Myositis affects the hip flexors, the hip extensors, hip abductors, and the hip adductors. So when your therapists tell you this muscle, that's where it's located. So you have the hip flexors. These are the muscle in front of your hip, and the purpose of that muscle is to flex your knee closer to your chest. They are involved when you walk, when you lift your thigh, when you take a step. That's the muscle you use when you climb stairs to bring your foot to the next step. That's the muscle that you use when you lift your leg when getting into a car. Hip extensors, these are the muscle located in the buttocks areas. Example of this is your gluteus maximus muscle. So the gluteus maximus is a muscle that helps you to stand up from a chair, to squat, to bend over, or even shift positions in bed. So this is a critical muscle that helps maintain your good posture and pelvic stability. The hip abductors, these are the muscles located also on the buttocks, more on the upper lateral area. An example of that muscle is the gluteus medius muscle. And the gluteus medius plays a crucial role in keeping your pelvis stable during walking and other movements. It makes sure that your pelvis stays steady during walking and various activities, helping you stay upright and balanced. The hip adductors, these are your inner thigh muscles. These are the muscles that bring your thighs together towards the midline, and it also helps in flexing the hips. So by understanding how these muscles work, we gain valuable insights into the everyday challenges that arise when they are weak, as well as their impact on mobility and balance. So let's talk about what happens when hip flexors are weakened by myositis. So these are the functional implications of muscle weakness. So when your hip flexors are not working as they should, It can lead to shorter, less effective steps and difficulty lifting your feet while walking. This may cause you to drag your foot or stumble, making walking more challenging and unsafe. A weak hip flexor can also make everyday tasks like lifting your leg into the car or getting into bed more difficult. You might struggle to get your leg up and over, which can be frustrating and very limiting. So by recognizing these challenges, we can better appreciate just how vital strong hip flexors are for smooth and effortless movement in our daily lives. Now, weakness in the hip extensors can lead you to, so remember the hip extensor, the glute max, is the one that you use for getting up from the chair. So if that muscle is weak, it can make it tough for you to push yourself up from a seated position. Climbing upstairs can also become a difficult task. Tasks like picking up something from the floor might seem simple, but when your hip extensors are weak, bending over can become difficult as well. So getting up from the floor can be a significant hurdle as well if your hip extensors are weak. So weakness in the hip abductors, particularly your gluteus medius, can lead to a waddling gait. This occurs when the pelvis drops on the side opposite to the weak muscle when lifting your leg. For example, in that picture, if the right hip abductor is weak, you will observe that the pelvis drops on the left side when walking and vice versa. So this imbalance results in unsteady gait and inefficient gait, which over time can contribute to hip pain and muscle fatigue. So understanding this effect underscores the importance of strong hip abductors for maintaining a steady, efficient, and pain-free ambulation. So let's dive into how myositis can affect your shoulder region and what it means for your daily activities. So myositis can lead to weakness in critical shoulder muscles, like your deltoids, your rotator cuff. And this is the muscle that helps to raise your arms overhead and stabilize your shoulder properly. Myositis can weaken the scapular stabilizers, those muscles that surround your shoulder blades. Those are the muscles that stabilizes the shoulder blades so that you can lift your arms overhead, such as reaching for an item in the closet or brushing your hair. Weakness in the scapular stabilizer can also cause winging of the shoulder blades, where the shoulder blades stick out due to the muscle atrophy and muscle weakness. So the deep neck flexors can also be affected in myositis. These are the group of muscles located in the front of your neck that are crucial for stabilizing and moving the cervical spine. They stabilize your neck, which is essential for maintaining proper posture and alignment of your head and neck. So when myositis affect these muscles, you might struggle with lifting your head from a lying down position, like getting up or getting out of bed. It can also contribute to poor posture, such as a forward head posture, which can put excess strain on your upper back and shoulders, which can lead to pain and discomfort. So beyond just muscle weakness, myositis can seriously reduce your muscle endurance and overall aerobic capacity. The condition not only weakens your muscle, but seriously impacts your endurance. So you might find yourself feeling worn out much faster than you used to, and even small activities can leave you feeling drained. As fatigue sets in, you are more prone to stumbling or tripping, which can lead to unsteady movements and a higher risk of falling. So now that we have explored how myositis impacts key muscle groups and how their weakness impacts mobility, how can we use exercise to effectively manage and improve this condition? So to effectively manage myositis through exercise, your program should be well-rounded and should address these key elements. Core strengthening, so focusing on building strength in the core muscle, particularly the transversus abdominis muscle. A strong core will help support overall stability and movement. Targeted strengthening. You have to zero in the affected areas with exercise for the shoulder, the hip, and the deep neck flexors. Muscle endurance training. Incorporate exercise designed to boost endurance in the specific muscle affected by myositis so that this muscle can withstand prolonged activity. Aerobic exercise. So aim for moderate level intensity, like walking briskly or stationary biking or doing some row machine for 20 to 30 minutes, 2 to 3 times a week. This will help improve your overall cardiovascular health and stamina. So by including all these elements in your exercise routine, you will support muscle strength, you will support stability, you will support endurance, which can make a significant difference in managing your myositis. So what does research say about the effects of exercise on myositis? So, excuse me. This research by Helene Alexandersson and her team in Sweden demonstrated that low to moderate resistance training adapted to an individual's strength and disease activity and combined with aerobic exercise can significantly enhance muscle function and aerobic capacity in recent onset PM and DM who are on immunosuppressant medications. So in this study, the participants who were newly diagnosed but stable on medication underwent supervised exercise with intensity adjusted by the therapist based on their fitness and strength levels. Research on endurance training has demonstrated significant benefits as well. So regular endurance exercise has been shown to reduce inflammation, lower disease activity, and also improve mitochondrial function. Endurance exercise activates the genes that promote capillary growth for increased circulation, mitochondrial development for more energy, muscle growth, while suppressing the genes that is involved in inflammation. This another exercise study by Manters and his group in his group in Sweden, which highlighted the benefits of an aerobic endurance-focused exercise program for established patients with PM and DM. So the patient in this study, they engage in 1-hour session of stationary bike 3 times a week under the supervision of a physical therapist. And that lead to improvement in muscle function, enhanced quality of life, and reduced disease activity. So based on this exercise study, it emphasized that incorporating both endurance and resistance training in your treatment plan can significantly benefit individuals with myositis, as long as the exercise intensity are individualized and adapted to each person's disease activity, strength, and fitness level. So when beginning a targeted strengthening program, here's what you need to know. So the key muscle groups to strengthen are, as I said in the beginning slides, are these hip muscles, the shoulder and the scapular muscle. And in terms of exercise frequency, aim to perform resistance exercises 2 to 3 times a week, but adjust your frequency based on your fitness level and how well you're tolerating the exercises. Before you start, have your physician clear you for exercise. If you have a flare, of course, do not exercise. Make sure you're cleared. And how do you start the exercise? It's safe to begin with low-intensity exercises without resistance in the beginning, such as doing active or active-assisted range of motion, especially if you are recently recovering from a flare. And then gradually introduce light resistance as you build strength and endurance. And then as you get stronger, you can advance to a higher intensity, lower reps exercises. But make sure you have therapy supervision in the beginning to guide you with proper form, proper weights. And then once you're confident enough to do those techniques, you may continue the exercise on your own. So as your condition becomes more stable and your strength grows, you may start incorporating weights into your routine. So this is the protocol that I use with my patient in the clinic when they are, how do I know when they're ready to do like using weights? So the step one is to find a weight that allows you to perform 20 repetitions with good form for one set. So the weight should be heavy enough that you can perform only 20 repetitions, but not more than 20. It can be 21 or 22. But if you do more than 20, let's say you do 25, you pick up like, let's say 2 pounds and you do 25, the weight is not heavy enough. You need to find a much heavier weight that you can do 20, but not 23 or 25, around 20. So you may be wondering why 20. 20 repetition is a good starting point for most myositis patients. Most myositis patients could tolerate the 20 reps based on my experience of working with this patient. So this is how I start my weight training with them. So once they found, let's say you're doing a bicep curl, and you found that 2 pounds, make you do 20 reps with good form. So you do the 2 pounds weight for a few weeks until you can do, what did I say here? Until you can do 30 reps with good form. And then at that time, when you're feeling, it's so easy, from a scale of 1 to 10, it's getting to like 2 or 3, then move on to step 2. So step 2 is finding a heavier weight that only allows you to perform 15 repetitions with good form for one set. So now the weight is getting higher, it's getting harder, so you're lowering down your repetitions. And then continue with the same weight for a few weeks until you can do 25 reps with ease. And then you move on to step 3. You find a much heavier weight that you can only perform 10 reps with good form. And then you continue that until you can do 20. And once you can do 20 with ease, that's the time you increase the number of sets. Now, at any point, if you experience any significant muscle pain or fatigue that lasts for several days, stop the exercise and rest until you are fully recovered. Oh, bless you. So always prioritize proper form over the amount of weight you're lifting. So as you all know, incorrect form can lead to injuries and setbacks. So focus more on executing your exercise with correct form. Second, to avoid overexertion and support, it is important to incorporate adequate rest between set and workouts. So I tell my patient to aim for like 1 to 2 days of rest between exercise session, or more if needed. So, or spread out your sessions throughout the week, or you can alternate between arm and leg exercises to give you some time to, for each body parts to recover. And it's also important to listen to your body. Be attentive to how your body responds to your routine. If you feel excessive fatigue or discomfort, it is very important to adjust your progression, lower your weights, lower down your repetitions, or maybe take a few more rest breaks in between sessions. Now, what are some targeted strengthening exercises you can do for the hip, shoulder, and the neck? So here are some examples of hip exercises targeting the hip flexors. So the hip flexors, as I said, these are the muscle in the front of your hip that will help you lift your knee to take a step, getting your leg into the car. So the first one is the supine march. So with this exercise, you begin lying on your back with your knees bent, and then you tighten your stomach muscle, and then basically you're doing a march. You lift your legs off the floor while keeping your knee bent, and then you return to the starting position and repeat with your other leg. So you may hold it up there for a few seconds while holding your stomach in, and then bring it back down. You should feel the more you do this, you should feel the tension in the front of your leg, in front of your hip. The next one is the supine heel slides. So basically, you're sliding your heel back and forth. So sliding one heel on the floor towards your buttocks until you feel a stretch in your knee. You may hold it there. At the same time, you tighten your core, and then repeat the movement. The next one, it's called the isometric hip flexion using your opposite arm. So basically here, you bend one leg up to a 90-degree angle, and you place your opposite hand on your knee, and then try to bend your leg towards your chest while using your hand to resist the movement. So basically, your leg is pushing against your hand, but your leg is not actually moving. It's an isometric exercise. And you may hold it there for a few seconds and then return to the starting position and repeat with the opposite arm and leg. Here's another hip flexor exercises. It's the straight leg raise. So before you lift your leg straight up, make sure the other leg is bent, the other knee is bent up. And then once you lift it up at the height of the other leg, you may hold it there for like a few seconds while keeping your abdominal muscle tight, and slowly return to the starting position and repeat to as many repetitions as you can tolerate. Next one is standing march using the counter for support. So you're basically lifting your knee up to your waist height, holding it there for a few seconds, and then lower it back down and repeat. And then also the last one is similar to the previous one, but you are sitting. You're doing a seated march. So here are some exercises to strengthen your hip abductors. Again, these are the muscle that is located in your butt that helps stabilizes your pelvis. This is the muscle that will help prevent the waddling gait. This is an important muscle for improving your balance because the hip abductors really stabilizes your hips so you don't get unsteady when you walk or when you climb stairs. So the first one is the side-lying clamshell. This is a very popular exercise for patients that therapists give. You may use a elastic band or without the elastic band depending on how strong your hips are. Make sure when you do the clamshell, when you lift the leg up, make sure that you do not roll your hips forward or backwards during the exercise. The next one is sidestepping using a resistant bands at the thighs. So you are standing and there's a resistance band loop around your thigh, and basically what you're doing is you're stepping sideways, and you are trying to stretch that band around your leg, and then you can hold it there for a few seconds and then return to the starting position. The third one is the bridge used with hip abduction with the bands. So basically you're doing a bridge. You're lifting your buttocks off of the floor. At the same time, when your buttocks is off the ground, you are stretching the band. You're stretching it with your knees. And then you're holding it there for a few seconds. If you want to make it harder to give you more challenge, you can also tighten your stomach muscles. The next one is the side-lying hip abduction. So basically, you are lying down on your side with your bottom leg bent and the top leg straight. And then basically, you are lifting your leg up towards the ceiling, holding it there, and lower it back down. You may use some ankle weights on the ankles if you need more challenge with these exercises. The next one is the lateral step-ups. So you begin in a standing position with a small step or platform on the ground on your side, and basically you are stepping up and down while holding on to a chair or sturdy object. And then when you do this exercise, make sure that you don't lean to the side, but keep your pelvis level and your posture more upright. The next one, this is a single leg bridge. This is a rather like more advanced exercises. This is really hard to do, but some people can do this. Single leg bridge, you begin lying on your back with both knees bent, and basically you're doing the bridge and at the same time, you're doing a leg lift. So it takes a lot of like hip stability to do a bridge and lift the leg straight up at the same time. You may not be able to do it in the beginning, but this is something that the higher level patients can perform, because this is really, it takes a lot of like core strengthening, the glutes, and lots of like pelvic stabilizers that are involved with that exercise. Now, we're going to the hip extensor strengthening. So this exercise focuses on your gluteus maximus muscle. These are the exercises that will help you to get up from the chair, to climb up stairs, to bend over to pick up things from the floor. First one is the prone hip extension. It's basically while you're laying down in your stomach, before you lift your leg up, squeeze your butt first, and then slightly lift your leg off of the bed. Hold it there for 5 seconds or so, and then relax and repeat. Next is the bridge. It's lifting your legs, your buttocks off the floor. Sometimes I let my patient put like a ball between their knees, and they can squeeze the ball while they're doing the bridge. The next one is the quadruped hip extension. Basically, you are on all fours, and then you begin with one leg extended, and then you gently engage your abdominal muscle, and then you lift your extended leg straight up as you exhale. Again, this is also a advanced exercises, because as you lift that leg up, you need some stability on the pelvis so it doesn't drop. Don't do it on the bed. Something soft. This is for somebody that can get up from the floor. You need something stable, because you may drop on your pelvis and lose your balance. These are hip extensor strengthening, but you are doing it in upright position. Mini squat while holding on to a counter for support. You are bending your knee to like 45 degrees, holding it there for a few seconds, and then going back up. Sometimes my patient will put like a belt, and then they put weights around the belt to give some kind of resistance. Or they don't, for more advanced patient, instead of holding onto the counter, they're holding dumbbells between their hands, and then while doing the mini squats. So it depends on the level of strength that you have. You can make modifications on these exercises. Next one is the wall squat. You're basically doing the mini squat, but you're using the wall for support and balance. And you're just, this is sometimes what I do for patients before they move on to the mini squat with counter support. Patients who are starting to learn how to do the mini squat, they use the wall for balance, and then they bend their legs to like 45 degrees, and then hold it there for like 5 seconds, and then they have to slide back up. Sit to stand. This is a very functional exercises. This is something that you do even throughout the day. You go up and down the chair. If you want more focused and targeted strengthening, you can try and see how many of these you can do in 30 seconds. And then you can monitor your progress. If you can do like 20 of these in 30 seconds, that's really good. Or 10 of these in 30 seconds. These are the adductors strengthening exercises. This is the muscle in your inner thighs. These are the muscles that will help stabilize your hips. And the first one is hip adduction isometric with a ball. You're basically squeezing the ball with your thigh using your inner thigh muscle, holding it there for 5 seconds. The next one is similar to the first, but you're doing a bridge while squeezing the ball between your knees. And the third one is basically sitting hip adduction with a ball. So here are some exercises to strengthen your shoulder and scapular area. The first one, it's called the scapular protraction inflection with the dumbbell. You're basically doing a punching movement while holding a weight. So keeping your elbows straight and holding like maybe, if you cannot tolerate weights, you can start without the weights. You can just do the punching straight up towards the ceiling and then holding up there for a few seconds. But if you do need more challenge, you can use weights. And then the second one is the shoulder flexion using weights, lifting your arms straight up above head for like 5 to 10 seconds. The third one is the prone shoulder abduction using weights. These are good exercises for your scapular areas for patients with winging. We want you to stabilize the shoulder so that you can use your other rotator cuff muscle to elevate your arms overhead. And these are some of the shoulder and scapular strengthening exercises. Again, shoulder abduction, this is moving your arms out to the side with or without weight. And then you have the shoulder external rotation, so you're holding like an elastic band and basically you're stretching it out. Now we're moving on to the deep neck flexor strengthening. These are the muscles that will help strengthen the neck flexors that will allow you to lift your head up when getting out of the bed. First one is the chin tuck. Trying to tuck your chin directly backwards, make it as if you are making a double chin and holding it down there for a few seconds and repeat. The next exercise is a progression of the chin tuck. You are basically doing a chin tuck while lifting your head about 2 finger breadths up, from the floor and holding it there for a few seconds. So for the core strengthening, so strengthening your core muscle is really important in patients with myositis. So among the core muscle, we want you to focus on the transversus abdominis muscle to strengthen the core. So the TA muscle is the muscle that, think of it as your natural brace because it wraps around your trunk. It provides support in your spine and your pelvis. So in order for you to activate this muscle, so you begin laying on your back with your knees bent and your feet resting on the floor, and you basically pulling your belly button towards the floor by drawing in your abdominals and then holding it there for a few seconds. So basically, you're tightening up, putting your belly button towards the floor, holding it there, and making sure to keep your back flat against the floor and avoid the sit-up motion. This is another core exercise. So here, you begin laying on your back. Begin laying on your back with your legs bent and your arms on your side. So you tighten your TA muscle, you pull your stomachs in, pull your belly button towards your spine, and then straighten one leg while lifting your opposite arm overhead. So it's like the opposite movements, and then return to the starting position and do it on the opposite arm and legs. So this is a more challenging exercise than the previous ones. So you begin on all fours or on your hands and knees. You engage your abdominal muscle and raise one arm forward, hold it for a few seconds, and lower it back down, and do it on the opposite arm. The next one is called the bird dog, which is a progression of the previous exercise. So basically, you straighten one arm and your opposite leg at the same time. So again, this takes a lot of stability on your pelvis to do. So making sure that your abdominals is tight and your hips are level during the exercise. So muscle endurance training. So as I said before, many patients with myositis experience significant challenges with muscle fatigue. And we want to make sure that you are also doing something to improve your muscle endurance. And the next exercise, like this one, the shoulder flexion, So for this exercise, you will need a metronome. So you can download the metronome apps on your phone and set the metronome to like 40 beats a minute. And you begin, so you play a metronome, and basically what you're doing is you're moving your arms up with the metronome, so you follow the beat. As many as you can do until you feel like muscle burn or muscle discomfort in your shoulder areas. The same thing with this exercise. You are doing like straight leg raise while keeping up with the beat of the metronome. If you want to do it, you can also engage your abdominal muscle while doing it to make it more challenging. You may put like 1 pound weight on your ankle if you need more challenge, but you have to keep up with the beat of the metronome. So as many as you can do until you feel some kind of discomfort but not pain, so like muscle burn, and you know that it's you're working your muscle hard enough. So for people with myositis, aerobic capacity and exercise tolerance are often reduced compared to those without the condition. And so when starting an aerobic training program, it is important to start with low intensity that you can handle and then gradually increase to a moderate intensity. So your goal is to perform an aerobic exercise at moderate level intensity to get the benefits. So moderate level intensity means that you can talk comfortably during exercise, but find it harder to sing. So this means that you should be able to have conversation with someone without getting too winded. And aim to exercise for 20 to 30 minutes, 2 to 3 times a week. You can choose between a steady state cardio, like walking at a steady pace for 20 minutes, or doing an interval training, where you can alternate between a steady pace, 5 minutes of steady pace, or brisk walking for 3 minutes, and then repeating this pattern throughout your workout. So in summary, a well-rounded exercise program should incorporate muscle strengthening, endurance training, core exercise, and aerobic activities. So you don't need to do everything at once. Begin with 1 or 2 exercises that you can handle comfortably, and then as you build strength and endurance, gradually introduce other types of exercises. Before diving into a new exercise routine, check in with your physician. If you're experiencing an inflammatory flare, it is best to hold off until you are clear to exercise. Seek guidance from your physical therapist who understand myositis to help you develop a personalized exercise plan. Well, since myositis is a rare disease, your local physical therapist may not be familiar with it. So to help bridge this gap, so try to share this presentation with them, or you can direct them to the TMA website. I have also included lists of research studies and exercise literature on my presentation. You can download this presentation on the TMA website as well. Sometimes when my out-of-state patient comes to Hopkins and they need help to connect to their local therapist, so what they do is with their permission, I usually contact their local therapist and we collaborate with what exercise plan I need, that's best for that patient. And lastly, when starting, give your body the time it needs to recover between sets and workouts, as this will help prevent overexertion. So it's important to really incorporate rest periods between your exercise. Do not try to push yourself too much that you will end up suffering or having more pain and more setbacks. Your muscle also needs to recover, and that's very important. Some patients that I have, if they over-exercise, most of them, they end up having like knee buckle, so they end up falling or tripping on their feet. So I tell them to have some rest breaks and allow your muscle to fully recover, because it needs some time to rest as well. So remember, fitness is a journey. Take it step by step. Listen to your body and enjoy the process. Thank you so much for listening. Thank you. Thank you. Yeah. Any question?
thought you were leaving. Did you hear me okay?
Yeah, I heard you. So unfortunately, I do not know of anyone. Are you from another state, I guess?
Salt Lake City area.
Salt Lake, yeah, unfortunately. Usually when my out-of-state patient comes to Hopkins, um, and they're looking for somebody that knows myositis, I usually tell them like, the most important thing is finding a physical therapist that will work with you, that is interested to know your case, that's willing to read literature on myositis. You know, um, we have done some webinars during the pandemic through the myositis support and understanding, and you can go to that website. We did some webinars, I believe, for IBM and other forums. You can connect them with with that website.
So it's on the MSU?
Yeah, MSU
Okay.
website. And I have also presented a course in Florida this past May through TMA. I believe they have a recording of that physical therapy and occupational therapy presentation to therapists in Southwest Florida this past May. So you may want to go to the TMA website to look for that presentation.
Oh, great.
So
It'll be under your name or patient
yeah,
resources?
yeah, it's actually a PT and OT course.
Oh, wow.
Yeah, so.
Thank you.
Mm-hmm. Yep. Yes.
Is there a terrible disadvantage in doing it in your bed instead of the floor? I have awful knees.
Mm. It depends on the type of exercises that you're doing. The one that where you have to go on all fours, as long as your bed is wide and stable, you don't want to when you lift your arms and leg, you'll end up falling.
No.
You may start with, if you cannot do that, you may start with something like laying down first
Yeah.
and building up your strength. And then from laying down, you can maybe start with something on your stomach.
But
Or
put my knees down on the floor.
Yeah,
probably.
I wouldn't do that because you may not be able to get up. It may be harder for you to get up. So start with something you can do
Thank you.
without causing too much pain. Yep. Yeah.
You had said earlier
Mm-hmm.
about a burn, just, you don't want your muscle to burn. It's hard to describe to someone when to stop, for me.
Mm-hmm.
And this is the result of falling just the other day. My black.
Oh, wow.
The day I had physical therapy,
Mm-hmm.
but I didn't feel tired. I felt energized,
Mm-hmm.
and I just turned and fell in the parking lot
Wow.
afterwards.
I'm sorry to hear that.
So I'm thinking, am I not speaking up and describing it well? I don't know.
I mean, when you exercise for myositis, you will feel some muscle burn. And we want you to have muscle burn because if you don't, in the beginning, if you have a flare, like when you're recovering from a flare, we are very careful on exercise intensity. We just want something active range of motion or active assisted range of motion when you're recovering from a flare. And then once your disease becomes more stable, then we introduce some light resistance. And then when you do the light resistance, that's when you feel more of the muscle burn. Now, is your fall as a result, were you walking and then you suddenly buckle on your knees?
I turned quickly.
Mm,
A
mhm.
normal movement,
Mhm.
in which and I don't know, my balance is not great.
Does that happen after having physical therapy session?
It only once,
One.
but I actually broke my nose 2 months ago, falling while I was playing with my grandchildren.
Mm-hmm. Mm-hmm.
And that was the same movement,
Yeah.
toward the left.
It's a rotation.
Yes.
I will consider using maybe a walker for extra support versus a cane. I know you don't want.
I know, that's what you- all
Because sometimes your muscles are not strong enough. when you're doing those movements in the clinic, oh, you can do them, but when you're actually standing and moving, it takes a lot of muscle coordination in order for you to balance yourself. If you don't have that extra support from the walker and you tip your balance over the edge, your base of support, your muscle is not able to recover fast enough. However, if you have a walker, an extra support, if your center of gravity go over the base of support, you have the walker to prevent the falls. You know, you continue using the walker until your muscle gets strong enough, different muscle groups strong enough to help you balance yourself. Yeah.
All right, thank you.
Mm-hmm.
We live in the country, pretty far from the doc. We have to go 50 minutes just to get to the physical therapy.
Wow.
Anyway, would having it more times a week be more helpful? Because of the distance, we're only doing it once a week. And then the other thing is, a lot of the physical therapists that they're young,
Mm-hmm.
and they have
I
the
know.
attitude of
I know.
no pain, no gain attitude.
Mhm.
Yeah,
She
and
does very the
Same thing.
exercise. She must, I think she has studied.
Yeah.
So,
Yeah, unfortunately, most of the therapists who's not familiar with myositis think, they don't realize that myositis is not a condition where no pain, no gain. It's not that. The muscle can fatigue so quickly that you can injure the muscle, you can lose your balance. So you have to proceed really slowly and really adapt the exercise intensity based on your patients. So in your case, your question about the frequency of, therapy, if distance is a problem, then ask your therapist to give you a home exercise program that you can supplement instead of going there for extra day or so. I would do that.
thank you.
Mm-hmm.
I think this is probably going to be a weird question, but because of fatigue, is there any mechanism that helps you figure out what muscles you're using when you're doing basic housework?
I'm sorry.
Basic housework. I mean, if you're carrying laundry up the steps, obviously you're doing some of these movements. If you're sweeping a floor or mopping a floor, is there anything that can help you figure out what muscles you're moving?
Yeah, so bending over, lifting, this is all the muscle that I was talking about in that slide. You have to strengthen the hip extensors, the glute muscles, because when you're carrying something, and also your arms. So it's like you have arm and leg weakness, ma'am, I guess?
Yes.
Yeah. I will do something. Are you doing any kind of therapy right now?
Yes, I'm doing PT right now, but I mean, I struggle with having fatigue, so I can't necessarily do both,
I see. Yeah.
So if I have to do things around the house, I want to see how it moves the muscles that I need to move.
Yeah, so I would focus first on something like the endurance exercise that I showed using the metronome. You don't have to lift you may not be able to do the exercise I'm showing on my slide where you lift the leg straight up. You have to maybe just do the slides first, the heel slide first, as many as you can do. So endurance is more of like doing as many repetitions over a period of time. So do as many as you can to build up strength, maybe with no weights, and on your side, on your back, sliding your heel, and then maybe going on your side and building those hip abductors. Something you know.
So I have two questions.
Yep.
The first one, as far as like the shoulders coming forward and stuff, I know they have a lot of posture correctors. and
Yeah.
stuff. Is that a suggestion to wear one of those throughout the day or some?
Uh-huh.
I mean, is that a good idea?
Yeah. Doing some of those scapular stabilizers, like squeezing your shoulder blades together.
Okay. And the second question is, I have been doing therapy for quite a while.
Mhm.
And the therapist said one of the muscles wasn't engaging and there was nothing they could do. And I sort of felt, I don't know, is that true? I sort of was like, well, I mean, I've been coming a long time, but, because I can't straighten this arm.
Are you able to lift it up?
I can lift it up to here, but like, if it's up, I can't make it go like that way.
I
Like,
see.
I can't go that way, or if I'm laying down, it'll fall and hit me in the face.
Sometimes,
And
just
say
by,
she said it was the tricep.
oh, or is it this, is it this movement?
Yeah, I can't
Yeah.
do that either.
Are you able to, it looks like, just by looking at your exam, it looks like the shoulder blades,
Mhm.
you have a winging, you think? That's your wing
If I
out?
do, it's probably slight right now,
Mm-hmm.
but, and she just, she, done the tap thing and stuff to get the
mhm.
reaction stuff, and she just said it wasn't engaging, and really there wasn't anything they could do.
Well, I would start with something isometric first, or something active assisted. Are they ranging your shoulder with their help?
No, there's a few exercises that they help with, but not many, and this side is just really weak,
Mhm.
the left arm and left leg. But,
Because,
I
yeah.
don't do any stretching or anything like that
The-
during therapy.
They don't do stretching.
Mhm.
So the issue is if you're not able to move your arms all the way up, sometimes it tightens up.
Mhm.
So there are many of my PM and DM patients who have shoulder weakness because they cannot do the full range. They end up having like a frozen shoulder type of limitation. So I always have the family members range their arms, so you stretch them, so that you may not be able to do it yourself, but it's important to address mobility because you may end up having like frozen shoulder type of impairments there, and you don't want that.
Okay, so
Yeah.
at John Hopkins, is that something like, say I wanted to come and make an appointment just for like a consultation? That way they could help maybe the therapist
Yeah,
that
yeah.
hasn't,
Yeah,
took that extra step to study?
yeah.
Okay,
We can do a full assessment on your shoulders and the hips and stuff, and see what we can do to address the
yeah,
issues.
because I feel like I've been going long enough, I should see some improvement, and
Mhm.
we're not really seeing much improvement.
Right,
So,
right. Yeah,
okay.
yeah.
All right, thank
I
you.
will do that. Yeah. Oh, yes.
Sorry. I'm newly diagnosed, and I'm just wondering if, I guess I'm in a flare now because it's new and sore as this, so my rheumatologist would be the one to tell me when I'm like basically not in a flare, when I can start doing something. She said I could do stretching yoga, like there's a Myositis from Charlottesville, a lady it was a lupus, I'm sorry.
Mhm.
And some sitting down and doing some stretching, but then my husband, who loves to exercise, is like, you need to start. I'm like, well, I'm not gonna start doing anything until someone tells me, because I'm just still 8 months in
Mhm.
and just getting diagnosis, getting this, but I don't want, in the meantime, I know I'm becoming so weak, not
Yeah.
well, or not strong.
Yeah, yeah.
I was never one to big time exercise anyway,
Mhm.
but when do you know, when should I start doing something? For me, should I wait for my rheumatologist to tell me?
Yeah,
Or
yeah, I would say the problem is if your CK level is trending up, we don't want you to exercise. If you are not on acute flare right now, right? That
I don't know. And I got down, I was trying to brush my cat,
yeah.
and I got down a little too low to
Mhm.
get her, and my leg, the pain in these
Mhm.
muscles, took me to my rear end. And then then my husband was in bed, I couldn't get up off the floor.
Mhm.
And I'm like, oh Lord. And so I was trying to roll over, because I got an 84-year-old dad, my
Yeah.
sister's a trainer, and I was trying to figure out how, but then I was hurting here, and I'm like, how do I do this? So I don't even know if I can get down on the floor
Mhm.
and do anything, maybe just sitting, whatever. But these muscles are so, they hurt
Mhm.
if I get down too low. I don't even want to try that again. So I'm not, I guess I need to know when, and do I discuss that with our rheumatologist? I have an appointment at the Myositis Center in January.
Okay, good.
So maybe I can,
Yeah, yes.
I just don't know if I should start doing
I-
any exercise.
You need to be cleared by your physician first, because making sure that your CK level or other enzymes are not trending up, going up before you start anything. However, you can do something like more functional activities, like walking,
Yeah, oh, yeah, yeah.
within, within
Yeah.
your tolerance, rather than doing something like really strenuous,
I guess I just, in my head, with this all being so new, I haven't felt right. I need to start getting out and walking. I have a perfect neighborhood to just do
Mhm.
my little thing, but I just haven't gotten out of my head to do
Mhm.
that, and I need to do that. But as far as anything more, I guess I just, like you said, to be cleared.
Yeah, to be clear.
Someone to tell me you're in an active phase.
Right.
So, because this is so new.
Right. Yeah, I would do that first. Yeah.
The ILD plays a part in all this too, right? So you're out of breath, a little short of breath, that kind of comes into play with a lot of this stuff.
Oh, yeah, you have ILD as well,
Yeah,
ma'am?
yeah.
Okay, yeah. So with some form of myositis, with interstitial lung disease plus the myositis, you have two difficult issues
Anti-synthetase,
there.
anti-synthetase.
Anti-synthetase, so you have like the shortness of breath
Yes.
plus the weakness.
Yes.
They're compounding together, which makes everything so difficult,
And I don't want to get weaker and weaker and weaker and weaker.
Yeah.
I mean, I feel like this has been 8 months, I haven't done anything. Like I said, I wasn't a big weight, whatever, but I wasn't like this.
Mm-hmm.
And I could go down to my yard, do something, come back up the little, barely an incline and not feel like I'm out of breath.
Yeah.
Or go, so I just don't want to get weaker, but I feel like I need to wait to be safe, I guess.
Yeah. I would wait until you get cleared by your physician, but you may engage with something more functional, like, walking for,
And I think she said I could do stretching, some movements,
Stretching,
some
you know.
things. I could,
yeah,
for now.
yeah, for now, yeah. Mm-hmm. Oh,
A lot of times, these movements of the legs and the arms, you
Hmm.
didn't mention anything about the back. How does these movements and exercises affect your back?
oh, you mean how myositis
Yeah.
affect the back? So, myositis per se doesn't affect the actual lower back muscles. It affects the hips.
Okay.
However, if you have a weak hip, your back muscles are working so hard. So some patients with myositis end up having back pain from muscle fatigue, overuse. So we want you to use your core muscles as well, this front here, to help the back. So the back is not working too hard, So
Okay, thank you.
no problem. Yeah.
And soreness, there's some soreness, just in muscle soreness.
As
And
well.
neck, I've been trying to sleep, but when my neck is sore, and then this is weird, I asked somebody, you got muscles in your skull, right under your skull, because sometimes I'll touch my head,
Mm-hmm.
and it'll be like bruise, and, it's just bizarre.
Yeah.
I think that ends our session.
Okay. Thank you so
So,
much.
Thank you, Dr. Ruben.
Thank you.